I'm Amber.
And I'm Peyton.
And today we are going to be presenting an ethical dilemma which will go in tandem with our skit regarding a patient refusing radiographs. So just jumping right into it, the case that we have is that Michelle Adams, who will be played by me, comes in for a routine cleaning. After reviewing the patient's chart, the dental hygienist, who will be Peyton here, notices that there is no documentation of her last x-ray. When mentioned to Mrs. Adams, she decides that she wants to save money by refusing the recommended x-rays. While this is her exercising her autonomy, the hygienist realizes that this puts her in an ethical dilemma. Not having record of x-rays is a form of non-maleficence, and it does not benefit the patient and can actually harm the patient due to undetected periodontal disease, decay, pathology, and more.
So with step one, it's the question. So our question is, should Mrs. Adams be treated without x-rays?
And the information that we currently have is that after doing further digging, the dental hygienist finds out that Mrs. Adams has not had x-rays since 2012. The last time she received x-rays, she actually gave pushback stating that she had just had them and didn't want to pay for them because she was saving for a trip to Mexico. The need for x-rays is urgent because even if Miss Adams has no signs of dental anomalies, most conditions cannot be identified just clinically. You need radiographs.
So the actions that we decided to take, we figured out two of them. So the first one, we could either educate Mrs. Adams about how radiographs are super important to be able to detect periodontal disease, decay, and other pathology, or we could go with turning Miss Adams away because proper dental treatment cannot be performed without x-rays, and wait until Mrs. Adams can meet the financial obligations of the radiographs that are needed to be taken for further treatment.
And then the ethical principles, we have two of them. Option number one, this option would honor beneficence, educating Mrs. Adams about oral health. And then option number two, we could turn her away because the dentist and the dental hygienist are preventing a potential lawsuit. Mrs. Adams could have an underlying condition, and if treated without radiographs, the underlying condition could be a contraindication for further dental treatment.
So our decision in step 5, we figured out that we should actually turn Miss Adams away due to not being able to provide adequate care without the radiographs. In order to avoid conflict, Mrs. Adams would be provided an estimate and informed that she will be welcomed back should she be able to accrue the funds for her radiographs for the next treatment.
And then in conclusion, the implementation, Mrs. Adams would not be treated in the clinic that day without radiographs. And then last but definitely not least, our skit to follow. Yay.
Mrs. Adams?
Hi.
It's nice to see you again.
Nice to meet you.
My name is Peyton. I'll be your hygienist today. You'll just follow me into my office and sit in this chair. I'm just going to ask you a few questions about your medical history. I know that Sally at the front desk got your blood pressure and your pulse today. So everything's the same. Nothing has changed from the last visit. Okay, so I see that your blood pressure has changed, or your medication has changed. Are you having any side effects from the change in the medication?
No, ma'am.
You feel good?
Mm-hmm.
Okay. So, Miss Adams, I see in our system that you have not had x-rays with us in 8 years. Normally, you should be getting x-rays once a year. We will need to take 4 bite wings and a panoramic x-ray today to make sure that you don't have anything abnormal going on that I cannot see clinically. And we'll have to have the dentist double check them and just make sure everything is okay. Is that all right?
No, I just had them. I literally just had them.
Did you have them with us?
I just had them.
When was the last time you had your x-rays?
I guess 8 years ago, but I feel fine. I literally feel the same. But 8 years, I just had them.
Step 1. Should Mrs. Adams get treated without x-rays?
Can I please just get you to clean my teeth and just get out? I have places to go. Can you please just clean my teeth and I get out of here?
Miss Adams, x-rays are super important for your oral health. I cannot clean your teeth unless I take dental x-rays today.
Please, please, I beg, I plead for you just to treat me without them. I don't want to spend the money to get them again. Please just treat me without them and clean my teeth.
Step 2, information. Miss Adams, in our system, you have not had them since 2012. The need for x-rays is urgent because you have had no signs of dental anomalies. Most conditions cannot be identified when I'm cleaning your teeth, okay? If you have a condition that I do not know about, it can worsen, or I cannot take care of it properly to help you or to give you adequate treatment so that it doesn't get worse. Step 3, the action. Miss Adams, if we can do one or two things here. I can take your x-rays to see if you have any anomalies, periodontal disease, decay, or pathology that can be harmful to your oral health. And I can treat you for these things if you have them. Or we can reschedule this appointment for a different day when your financial obligations can comply.
Well, why don't you tell me what to do here? You're the professional. You make the decision.
Step 4, the ethical principles. Option 1, if we go with just educating Mrs. Adams, we would honor her beneficence, educating Mrs. Adams about the importance of her oral health at the end of the day. Your oral health works in a tandem with your overall health. If we go with option 2, by telling her that she can leave and we can do this at a later date with her financial obligations, the dentist and dental hygienist are preventing a potential lawsuit. Ms. Adams can have an underlying condition, and if treated without radiographs, underlying condition could be a contraindication for successful dental treatment.
Well, I'm trying to go to Mexico here. I've been saving for a really long time to go on this trip to Mexico. I cannot afford to pay for these x-rays. I will not pay for these x-rays.
Step 5, the decision. Miss Adams, we're going to have to reappoint you for a later date when you can comply with the importance of radiographs and financially. Sally at the front desk will give you an estimate and inform you that you are welcome back when you have the financial means to proceed with your treatment.
Okay.
All right.
Sounds good.
Okay, you can follow me out the door, okay? Come with me, right this way. It will give you a phone call and we'll work everything out, so just call us after Mexico,
Perfect.
okay?
Thank you so much.